My sister had called me and asked me to do her the favor of taking Sebastian to the hospital the following day to get checked because his breathing was labored. On my way home, I was on the phone with my husband. We were talking, and as is customary, Sebastian starts to cry. I had left the hospital maybe 10 minutes ago when Sebastian stops crying. So I put the car in park right then and there, and I just jumped to the back seat. When I saw him, his body was pale and he was unresponsive. At that moment, my heart just dropped. I didn't know what to do. I was scared because he wasn't breathing. I ran out of my car holding the baby and I started screaming for help. Sebastian was already blue. I just dropped to my knees and performed CPR on him. It was just like my body knew what to do. My brain was not thinking straight. The training I'd had previously, it just kicked into motion and it all came back to me. After what seemed like an eternity, he started crying and breathing again. At that moment, I felt nothing but relief. That's when I started crying. I think it's important to understand that CPR is not something that just doctors and firefighters and nurses can do. It's really something that everyone can do.
Infant CPR is for babies younger than 1 year based on body size and weight. Check the infant for response. Tap the bottom of his foot and call his name. If no response, yell for help and have someone call 911. Check for breathing for 5 to 10 seconds. If there's no breathing or only gasping, begin compressions immediately. Place 2 fingers in the center of the chest just below the nipple line and push down about 1.5 inches. After 30 compressions, open the airway to a neutral position. Cover the mouth and nose and give 2 small breaths, then resume compressions. Perform CPR for about 2 minutes or 5 cycles of 30 compressions and 2 breaths. If the infant is still unresponsive after 2 minutes of CPR and no one has called 911, go call 911 yourself. Now let's practice infant CPR on a mannequin.